Psychedelics, meditation, and religion. Those are three ways people can go on to have mystical experiences. But what exactly is a mystical experience? Historically, it's been described as a state of consciousness, where the person feels a sense of unity or oneness with the universe, and overwhelming ecstasy and feelings of love and insight. Though these experiences are subjective and vary considerably, other common themes involve remarkably raised levels of awareness and attention, but without thoughts. This week, we spoke to Rick Strassman, Associate Professor of Psychiatry at the University of New Mexico School of Medicine. He's best known for performing the first human study with psychedelic drugs in over 20 years, after a research hiatus that began in the 60s. Given all the hype with microdosing and psychedelic medicine, we wanted to know, what are some therapeutic uses and benefits of psychedelics?
The putative benefit of having a mystical experience. If you look at the religious literature and the substance abuse literature, you'll find that oftentimes if you're an incorrigible alcoholic and you have a if you bottom out, see God or experience salvation, religiously or spiritually, you'll stop drinking. And that occurs with meditation. You'll have a breakthrough experience which will end your depression, your post-traumatic stress, your anxiety. The thinking went, if you could induce a mystical experience with drugs reliably, then you would see beneficial effects on any number of problems, especially substance abuse. Back in the 60s. And also, the despair, which is associated with terminal illness. If you undergo a mystical experience and you're dying, you won't be as afraid of, dying, the theory goes. When those studies were taking place in Maryland, that was the model. They prepared people to have those kinds of experiences. And during the drug effect afterwards in the integration phase, everything was interpreted and steered in the direction of having a mystical experience. And there were quite promising results for alcoholism, for heroin use, and for the terminally ill, who were depressed and despairing.
A major focus of Dr. Strassman's work is a psychedelic drug called DMT, or as Dr. Strassman calls it, the spirit molecule. DMT stands for dimethyltryptamine and is actually a naturally occurring chemical substance that's chemically similar to melatonin and serotonin. What's interesting is that some research shows that it's made in the brain and that levels increase in dying mammals.
When you give intravenous DMT, it begins working within a few heartbeats. There's an experience of internal pressure and acceleration. There's a high-pitched noise, sound, which builds in intensity. You begin to experience kaleidoscopic visions, swirling colors, brightly, very bright, and extremely saturated in their intensity. And within about 30 seconds or 1 minute, with the higher doses, people describe a separation of their mind from their body. The effects peak within maybe 2 minutes, 3 minutes or so, at which time you're transported into this world of light, which is full of things and activities and content.
In the full episode, we talked to Dr. Strassman and Dr. Ken Tupper about the research that's been done so far about how psychedelics like DMT may be used to treat certain mental health conditions, including PTSD and alcohol substance use disorder. Listen to #psychedelics on the #health podcast to hear the full story.